Hello again. That's a nice case, which is closely related to the previous one, case number 16. That's another subchondral insufficiency fracture, SIF. You can see there is a fracture line, there is some bone fragment here, which is not detached. There is huge amount of bone marrow edema surrounding this fracture line, and there is huge amount of inflammation paracortical in this area, which is called the metaphyseal burst sign, which has something to do with engorgement of the vessels. Like in many cases of subchondral insufficiency fracture, there is a torn meniscus here. You see very well that this is grade 3 meniscal tear with instability of the meniscus. Okay, external meniscus looks nice. If we look on the sagittal, we can appreciate that the bone here tends to calcify. It's black, and here there is an area of more hyperintensity than the rest of the bone marrow edema. Fluid inside the knee, cruciate ligaments looks alright. Medial collateral ligament is thickened and some signal changes consistent with grade 1 tear. Okay, what if we look on this T1? In this T1, this lesion looks scary, but in the end that's a subchondral insufficiency fracture, quite recent, with huge amount of bone marrow edema and inflammation outside the bone, and a grade 3 meniscal tear in posterior horn with instability of the meniscus. But what happens after 3 months? The patient comes back for a follow-up, and we can appreciate that the meniscus is in the same state. It's torn. You can basically see it better because that's a different kind of machine with different protocol, but nevertheless this is an instability of the meniscus. And now you can appreciate what happened with the subchondral insufficiency fracture. The most important sign that is not going well is this macro geode here, which is sort of a subchondral cyst, which is quite big, around 6-7 millimeters. We cannot see properly the communication with the joint space, but it probably exists. Nevertheless, the existence of such a subchondral geode, and especially if it's newly formed in the past couple of months, 3 months in this case, it's a sign that this patient is not going to evolve very well. Probably this area here will collapse. He will have osteoarthritis quite soon. The meniscus, the torn meniscus, doesn't help, of course, in this setting. This is a poor evolution of subchondral insufficiency fracture of this patient with instability, the torn meniscus, and instability of the posterior horn of the medial meniscus. Thanks for watching. Please watch the previous video where there is a favorable evolution of a subchondral insufficiency fracture.